Intellectual and Developmental Disabilities, abbreviated as IDDD. Subscribe, like, and share so you can receive notifications for future videos. In this presentation, we will cover various topics regarding intellectual disabilities, including what's in a name, characteristics and identification, causes, prevalence, educational consideration, learning goals, transition, and a summary. First, let's look at what's in a name. In 2010, people with intellectual disabilities were called very dehumanizing names such as idiot, imbecile, moron, retarded, and if someone wanted to be correct, they said mentally retarded. After 2010, the name was changed to intellectual disability. When the term mentally retarded was used in the past, the term literally translated to slow mind. Remember, we want to keep the person first, so we're no longer saying mentally retarded. We are now focusing on the person first, so the term intellectual disability allows the person to be known as having an impairment with cognitive functioning. Characteristics and identification. What to look for? There's two main things to look for. First is a significantly sub-average general intelligence quotient, or IQ, and the second is deficits in adaptive behavior, or life skills. First, let's look at IQ scores. To better understand intellectual disabilities and several other disabilities after this presentation, we first need to understand the IQ normal curve. So if we look at the line right down the middle, that normal curve is a score of 100. And that score of 100 is the human population's average IQ score. If we move over to the right, to the very next line, this score would be 115. If a person scored 115 on an IQ test, they would be considered to be at the high average IQ band. If we look on the left, this number is 85. If a person scores an 85 on an IQ test, they are said to be at the low end of an average IQ. The important thing to remember is that all scores between a score of 85 and 115 are termed average. Now, if we go down a little further to 70, a score of 70 is the criteria for intellectual disability. Why is this so? Well, there are things called standard deviations, and if you notice, there's two jumps from the average score of 100 down to the score of 70. There are two standard deviations which meet the criteria for a diagnosis of an intellectual disability. Depending on the severity of the disability, the IQ score would be even lower. So what would this gray area be right between 70 and an average of 85? We call that below average, but it's not low enough to be considered an intellectual disability. If you look at this criteria here, a mild intellectual disability, a person with this criteria or classification would have an IQ between 70 and 55. If the disability is a moderate level, then the IQ would be between 50 and 35. If the child or person has a severe intellectual disability, the IQ score would be between 20 and 35. And finally, if the intellectual disability is profound, then the IQ score would be 20 or below. We're done with all of the complicated things. Let's move on to adaptive skills. People with intellectual disabilities and developmental delays need lots of practice with adaptive skills. The first set of adaptive skills are social skills. Social skills are ways that we can communicate with others, make friends, and just live life to the fullest. So ways that we can help children practice social skills or by playing pretend, role playing, playing with puppets, any way that they can practice communication and socializing. Next, we have gross motor skills. These are skills that involve your large muscle groups. So kicking a ball, bouncing a ball, climbing, running, these will all get the person's big muscle groups working and more coordinated. Next, we have fine motor skills. Now, fine motor skills use the small muscle groups. So tying shoes, we're using our fingers to tie the tiny ribbons or bows in our shoes. Writing or drawing requires you to hold a pencil or a brush if you're painting, or a crayon. And again, we're using the small muscles within our fingers. And also playing with blocks or other small toys. Again, we're using those small dextile muscles in our hands. Next, we have self-help skills. We need to have students with intellectual disabilities practice brushing their teeth, bathing, brushing their hair, toileting, and again, tying their shoes. These are all things that contribute to the everyday quality of life. Another reason people with intellectual disabilities really need to practice adaptive behaviors is they may have trouble interacting in a typical way with peers, which is why we want to focus on those social skills. Next, they may not recognize dangerous situations or dangerous people. They're very welcoming of others, and they're always seeking others, not always, but they often seek others' approval. So they may not know when someone is being maliciously rude or purposefully trying to harm that person. And next, they may be at risk for being taken advantage of. Again, often they try to please others so that they can make friends. So they may do things that are inappropriate, and people without intellectual disabilities may ask someone with an intellectual disability to do something that's not appropriate, and so they're being taken advantage of. Here's a summary of some of the adaptive skills taken from the Vinland test. On the domain side, you'll see that there's communication, daily living skills, socialization, motor skills, and maladaptive index, which are optional skills that we can teach students with intellectual disabilities. On the right, you'll see the subdomains for each category. So in communication, we have receptive and expressive communication. In daily living skills, we need to look at personal daily living skills as well as domestic and community living skills. Next, we have socialization. We want to focus on play and leisure time, but we also want to work on those interpersonal relationships. And as shown in previous slides, motor skills include fine and gross motor skills. When we're looking at psychological and behavioral complications or characteristics, people with intellectual disabilities have issues with working memory problems. They also have limitations in language comprehension and development, self-regulation problems, deficits in metacognition, and when motivation is an issue, they're looking for outside sources rather than looking within themselves to be motivated. There's also links between genetic syndromes of intellectual disabilities and particular behavioral phenotypes. So if the intellectual disability was caused by a genetic syndrome, it's possible that that same genetic syndrome will have particular behavioral phenotypes. Next, we have causes. Looking at causes, there are three areas we're going to focus on: prenatal, which is before birth, perinatal, which is during birth, and postnatal, or after birth. First, let's look at prenatal. There are chromosomal disorders. So within the human body, we have chromosomes, and one particular disability that we are more common with is Down syndrome. In Down syndrome, the 21st chromosome produces 3 chromosomes rather than just 2, causing Down syndrome. And Down syndrome always has some form of an intellectual disability. Next, there are disorders of the brain formation. So if we look at microcephaly, you'll notice that the child on the left who has microcephaly, their head size is smaller and their brain size is smaller than the normal child on the right. If we're looking at hydrocephalus, then you'll notice that the normal brain is on the left and the child on the right has a larger head and a larger brain. And finally, we're looking at environmental influences, such as fetal alcohol syndrome, where when the mother is carrying the baby, if she takes in too much alcohol, then the baby can have various levels of fetal alcohol syndrome. And there's also infections that the expected mother may pass to her baby, such as rubella. Now, if we switch to the perinatal causes, there is the cause of anoxia, which is low oxygen to the brain, low birth weight or premature children, and infections passed on by the mother. Looking at postnatal, there are biological causes such as meningitis, which is a bacterial infection in the brain stem, encephalitis, which is a viral infection in the brain. Also, there's hereditary factors. And there's also psychosocial factors such as poor environmental circumstances. This could include excessive child neglect and also lead in the paint or lead in the environment that is getting into the child's body. Prevalence. Based on the percentage of people in the world or the population in the world of people who have an IQ of 70 or below, it's expected that 2.27% of the world's population would have an intellectual disability. However, only about 1% of people are actually identified by an IQ score. The most prevalent factor is by looking at the deficits in adaptive skills. Look at some educational considerations. Early intervention is crucial. The sooner we're able to find out if a child has an intellectual disability, the sooner we can help them overcome their difficulties and improve their skills. Whenever possible, try to use real-life examples, such as going to a laundromat so they can learn how to fold clothes, use the washing machine or the coins. Maybe you take them to the library so they can learn how to get a library card and check out books and look for books. There's also baking, which is fun and tasty, but they can learn how to mix together recipes and put things in the oven. Next, of course, we could take them to the grocery store so they can learn how to find items throughout the store and see the prices. Using prompts and cues is an excellent way to scaffold learning for students with intellectual disabilities. This video on the right is a great example for how to use least to most prompting and is linked in the description. Choral responding is another great technique to help students learn how to think before they respond. If you would like to know how to use choral responding, the video on the right is a great visual example and is linked in the description. Okay, a few other strategies that you can use are making sure you have a target behavior, mastering a foundational skill before progressing on to a new skill, monitor progress and make changes, and positive reinforcement. Now, you may notice a lot of these skills can be used with other students who do not have intellectual disabilities, and you are absolutely correct. So let's look at a few accommodations and modifications that can be used with students who have intellectual disabilities. For accommodations, we want to give extended time. They may need more time to complete assignments. We want to give preferential seating because we want to make sure they're sitting with a group of students who are sympathetic and kind to the person with an intellectual disability. We also want to make sure that the seating is free of distractions. We can always provide a hard copy of notes to diminish or decrease requirements of writing within the class. And of course, we can always check for understanding. And notice a lot of these accommodations, just like with some of the teaching strategies, can be used for students who do not have an intellectual disability. Looking at modifications, we may shorten the schedule so that the students don't have to focus on one particular subject matter for too long. So we can shorten their class schedule. or we can shorten the time that they need to finish an assignment. Next, we have alternative presentation format. So we can give them different choices of how they would like to present what they've learned in class. Next, they can have alternative responses. So maybe instead of writing their response, they will give an oral response or record their responses through Word using the speech-to-text feature. And finally, we may give alternative assessments. Alternative assessments may include 3 answer choices on a multiple choice exam rather than 4, or various other modifications to the exam. Now, these are just examples. Of course, there are other accommodations and modifications that can be used for students with intellectual disabilities. Some special education services used for individuals with intellectual disabilities are services for academics, social skills, adaptive skills, speech and language, occupational therapy, physical therapy, functional living skills, behavior intervention, and self-management skills. Transition. Looking at transition and planning for transition, we want to focus on having individuals with disabilities achieve independence to the greatest extent possible. So we're looking at their life skills, which could include domestic skills if they're able to cook for themselves, if they're able to clean up after themselves within the house, and also hygiene, toileting, all of these different personal skills. But we're also looking at community skills. Are they able to reach out to friends, go to the movies, maybe go have tea or coffee with someone? Do they have the skills in order to have a playful and leisure life within the community? We also want to look at employment skills. We want to make sure that we've taught them skills to make them eligible for employment. So they may be bagging groceries at the grocery store, or maybe they're helping at a bakery. Perhaps they're helping sweep the floor at a grocery store or other places. They may even be able to be a cashier at a slower running market. Next, we have self-determination skills. We really want to focus on autonomy and having a wherewithal of who they are. So unfortunately, a lot of times people with intellectual disabilities develop a learned helplessness due to the caregivers or the educators or people that are within their life. They start to feel like they're not capable of doing certain things, or they start to rely on others around them to do things for them, which causes a learned helplessness. We really want to focus on autonomy, and we want to make sure that the students reach a level of independence that is the highest potential for that particular student. So let's look at everything we've learned in this video. We started the presentation by looking at what's in a name. We learned that in the past, people with intellectual disabilities were called mentally retarded, but that term was not putting the person first, so it was changed to intellectual disabilities. Next, we looked at characteristics and identification. We focused on the IQ score of 70 or below as being the diagnosis level for intellectual disabilities, and we also looked at deficits within adaptive skills. We then looked at causes from the postnatal, perinatal, and postnatal times of life. We followed up with prevalence, looking that there's an expected rate of 2.27% of the population having an intellectual disability, yet only 1% are actually diagnosed based on IQ alone. We really focus on adaptive skills. Educational considerations was filled with information on a few teaching strategies such as choral responding and prompting. We also looked at some of the special education services that a person with intellectual disabilities may require. Finally, we ended with transition, focusing on employment and life skills. We also wanted to make sure that we focus on making the person as independent as possible.